lower 4 inches is extraction only. Lower 4 inches is 2 implants, right?
Look at the scan.
So 4 2 to 3 2, right? Only 2 implants. So we'll see the anatomy of 4 2. Okay. The anatomy is very much not favorable, right? So it will be a little challenging situation here. Here the bone is cancerous. If you use a BCS design here, weightless stability. We cannot use a compressive now because buccal will be fully exposed. So either BCS or BCGX we have to use. If BCS we are not getting stability, we have to go for BCGX. So we need a BCS. 17 or 19. 19 is that right?
1.
So this kind of situation better to open the flap mainly or properly. Just trying to do without opening the flap, you will slip here. Even if you drill properly here, placing implant it will slip into this direction. So only 2 implant is possible here. You can see in the see these are the 4 inches. Okay, 1 and 2 is enough. Because when you go to the apex, they are becoming very close. Only with 2 implants. So please make 3 implants not limited here. Here also the bone anatomy is very much unfavorable. Even if you start the drilling from here, this buccal width is very much deficient. Right? And this bone quality is also very much cancerous. What we can do is, or we can place the implant, shorter implant. BCS. Compressive is not in question because labally the ones thing. This area will get good stability because buccally cortical, newly cortical. If the thread is engaged in this spot, it will be stable. The moment the thread goes into here, it will become less stable. So, if you select a shorter BCS, you will get good stability. If you select a longer BCS, the stability will get reduced. So, the bone width is also very less. So, it will be a challenging situation. Around 5 mm.